AskReddit number 10. What is a seems to be harmless asterisk symptom that requires an immediate trip to the ER? I got a small cut, little more than a scratch, on my arm cleaning under a conveyor at work. The sort of thing one barely notices. It was black with coal dust, so I rinsed it off. I didn't give it a good soap and water scrub until I got home several hours later. A few days later I had a dark red bump with what looked like a pimple on it where the scratch had been. I figured it could be an infection, but there was no pain or discomfort, so I figured it would heal. After a few days of it remaining the same, it suddenly grew larger and nastier looking. Still no pain or discomfort. I figured I needed antibiotics, so I made an appointment with my doctor. It was going to be a few days. When talking to my mom, who was a nurse, on the phone she said it's serious and if I can't see the doctor that same day then I need to go to urgent care. I went to urgent care and the nurse practitioner didn't seem too worried. Then I rolled my sleeve all the way up and they saw red streaks going from the infected area up towards my armpit. I was very surprised what happened next, since I'll imagine people in urgent care see all sorts of bad stuff. They freaked out, saying I needed to go to the emergency room immediately. They asked if I felt okay and could drive myself. When I said yes, they said they'd call the hospital and give them my info and let them know I'm coming. They said I may have to stay for a couple days on 4 antibiotics because I had sepsis, an infection spreading through my bloodstream. I had to get lots of medicine, but only stayed in the hospital for 1 day. Apparently it was so serious because once the infection passes a certain threshold, people go from feeling fine like I did to deathly ill in minutes. Make sure to clean any cuts well right away. Comment: sepsis is no joke. My sister died from an antibiotic-resistant blood infection back in 2021. She got a slight sunburn on her lip that got infected and was dead 2 weeks later. Sudden change in vision. In my case it turned out to be a brain tumor. I waited too long and now my vision loss is permanent. But I went early enough to still be alive. Superficial burns to the face, typically from barbecue or stove lighting accidents. It may seem like just some singed eyebrows, but if you were inhaling at all when the accident happened you could have burned the inside of your throat. Most people present with normal breathing, but as the injured tissues swell, it can close the airway. Most of these people feel fine directly following the accident and end up intubated if they make it to the hospital. This might not be immediate trip to the ER, but it certainly is immediately make a doctor's appointment ASAP. If you notice a red spot on one breast that isn't going away, if you have new orange peel like dimpling on one breast, or one breast appears swollen, any of those can be a sign of inflammatory breast cancer. That's a particularly aggressive form of breast cancer that's usually only found in more advanced stages. You usually don't have a lump. Headache and a neck so stiff that you're unable to look straight up. Sign of meningitis, inflammation and swelling of the brain that has gone so far that your brain is pressing down on the brainstem. Could be lethal within hours. A migraine that's much more painful than usual. Apparently a stroke is not always accompanied by the other well-known symptoms. I'm on blood thinners now. Hit your head hard? Get it checked out. I had a friend who fell out of a chair at a work party and hit their head hard on the ground. They shook it off. Started complaining about vision problems over the next several weeks. Their work performance suffered. Then, between work and their wife, the people around them pieced together that they could no longer read at the same level. It wasn't their vision, it was their comprehension. They couldn't even perceive what was actually wrong. Long story short, it was a serious TBI. They had to go on disability and into rehabilitation therapy for over a year. Edit: man, a lot of folks are not seeing the forest for the trees. There are plenty of stories below of people who could have had surgery to save their life after a bleed. Thank you for sharing, I am so sorry. Plenty of people that might have gotten other interventions or monitoring to intervene earlier to help. Yes, there are shitty doctors out there that will not care about concussions or TBI, traumatic brain injury, risk. Health systems everywhere have them. There are also good doctors as well. Give yourself a chance. Also, consider the importance of documentation. Some more details about my friend is that they had to go through the hell of claiming workers' comp, since it happened at a work event, and having several months of reduced duties. Since they didn't get checked out right away, it was tough to have a timeline. It was also difficult to get a proper referral to a TBI specialist clinic in physical therapy. Things worked out for them in the long run, thankfully, but documentation and a timeline of changes help immensely with disability claims. Disability can happen to anyone, including you. Document everything. Also, the people who care about my friend's gender are weird. I used they because they use they. Look at the 99.9999% of 3K upvotes that didn't care because it doesn't matter and is unrelated to the topic. Stop inserting your discomfort and hate into everything. Superficial burns to the face, typically from barbecue or stove lighting accidents. It may seem like just some singed eyebrows, but if you were inhaling at all when the accident happened, you could have burned the inside of your throat. Most people present with normal breathing, but as the injured tissues swell, it can close the airway. Most of these people feel fine directly following the accident and end up intubated if they make it to the hospital. I had an infection in my toe, ingrown nail, when I was 16 or so, and they gave me antibiotics. The next day in school I developed a fever of 104F, my leg went numb, and the skin on my leg was discolored and hot. The antibiotics they gave me weren't working for some reason, the infection went up my leg, and I developed cellulitis. They gave me different antibiotics and those worked. But at the urgent care they told me if we had waited any longer to go in I could have needed 4 antibiotics. If you have an infection and start developing new or worsening symptoms, despite being on antibiotics, talk to your doctor or go to urgent care ASAP. Prolonged breathlessness. Mine turned out to be a serious pulmonary embolism. Lucky to have survived the 6-hour wait for treatment. Red streaks near a wound, particularly on the limbs, can indicate a spreading infection and may be an early sign of sepsis. I know 2 people who had no other symptoms besides the streaks. Both were admitted for sepsis and in hospital for a while. Comment: I worked at a preschool where a little girl scraped her knee and then picked at the scab. It wasn't getting better over a period of weeks. She started limping and sitting down during recess instead of playing. Her parents thought she just wanted to be babied and carried because she had a new baby brother and was not adjusting super well. Then her knee developed red lines near the wound. The main classroom teacher recognized the sign and immediately called her parents to take her to the emergency room. Being tired all the time, suddenly. Last year around the fall we noticed my dad getting tired really easily, needing to sit down when going for a walk, sleeping in way later than usual, etc. He had gained some weight, so we told him he should lose it cause it's obviously affecting him. Even our doctor told him he should really watch his health and eating habits if it's causing him discomfort. It got to a point where we got blood tests done to see if he's pre-diabetic or something. Then they noticed he's got really bad anemia and very high iron levels, which is unusual. They sent him to the ER for an emergency blood transfusion, where he met with a hematologist who immediately told him it looks like his bone marrow basically stopped working. After a week in the ER they diagnosed him with MDS, a form of blood cancer, and his only way of survival was a stem cell transplant. He got very lucky that they found a 100% matching donor fairly quickly and he's seemingly recovering now. Always go to the doctor. Comment: but like, how did you know it was irregular? What did it feel like? I have atrial fibrillation and supraventricular tachycardia. AFib feels like your heart dropped or got hit in the chest. There's a deep flutter/rumble in your chest you can't touch, and sometimes it's strong enough to make you start coughing or like you can't breathe. Mine is mild enough I don't need treatment, but I get assessed every 2 years. The SVT feels much stealthier. I don't know I'm irregular until I start feeling dizzy and my ears begin ringing and I can't quite catch my breath. I use a vagal nerve stimulator to help regulate my heart rate and it's part of my maintenance, but my SVT is also pretty mild and requires no other treatment at this time. However, my sister has the same condition and presents more severely. While my heart rate is capped around 165 at resting, hers was much higher at over 195 that involved total collapse and she needed 2 catheter ablations. Now she's stable. Pain in one breast after lying on it and are feeling a lump in the breast as a man. Breast cancer can and does happen for men. What's worse, doctors can be dismissive about it. Do not give up until it's checked through ultrasonography, even if you have to get a second or third opinion. Edit, just realized that's not an ER kind of emergency, but leaving it up for awareness. The reason I posted it is because it seems to be harmless if it happens to a man instead of a woman, but it's not. Before I was admitted to the ICU for 2 weeks, I had muscle tetany, felt like pins/needles in my feet, arms, chest, and weirdly enough what felt like my nose for weeks. Thought it was just poor circulation, and turns out I had undetectable potassium and phosphate levels which did bad damage to my liver and kidneys. I went months without going to the ER because I thought I was being dramatic. Literally never write things off as something else, it's always better to look crazy than be dead. Also, for those that are biologically female, losing your period or prolonged amenorrhea is oftentimes a sign of something larger going on that's attributed by doctors as stress. Always get it checked. Not really a symptom per se, but if you have received an electrical shock. Even if there aren't any electrical burns and even if you feel fine. There is always the potential that a shock could send your heart into an irregular rhythm which could end up fatal, so best be on the safe side and go get checked out / have an EKG done. I was 25 weeks pregnant and noticed some watery discharge / I was confused I might have been peeing myself a little. If you Google watery discharge while pregnant, Google tells you it's totally normal. I felt totally normal otherwise, no cramping, blood, or anything else unusual. I called my OB after about 12 hours of this, just to check in after my husband felt concern. I expected her to set up an appointment with me the next day, or go to urgent care in the morning, but she said to go to the ER immediately. Once I arrived at the ER, I expected to wait for hours. But they admitted me immediately. Turns out my water had broken. I was expecting a huge gush like you see in the movies, and I was having contractions 1 minute apart that I couldn't feel, and I was going into preterm labor. Something called PPROM. At 25 weeks I was still in my second trimester, hadn't planned a baby shower, labor was something that felt a long way off. I hadn't even started prepping our nursery. I spent 46 days in the antepartum unit of the hospital on magnesium drips and trying to delay labor as much as possible, and ended up having my baby at 32 weeks. After my long hospital stay and some time he spent in the NICU, he's a happy and healthy 1-year-old now. Acid reflux. I was diagnosed with a hiatus hernia about 20 years ago. I am 54 male. I was sitting after dinner, tilted my chair back and dozed off in front of the TV. I woke up coughing and tasting reflux in the back of my throat. Leaning forward in my chair, I coughed to the point of needing a deep breath, took a gasping breath and felt something was wrong. 10 minutes later it was getting harder and harder to take a big deep breath. My wife called an ambulance, and when the doors on the ambulance closed I stopped breathing altogether. 13 minutes and 42 seconds later we arrived at the hospital for resuscitation. From there I went into a medically induced coma for 10 days. Aspirated pneumonia. The gasp of air I took in my chair filled my lungs with stomach acid. The acid burned holes in my lungs and no oxygen to my brain. Simple acid reflux killed me. Literally. So be careful, it don't take much to visit the other side. I was thankful I returned to my wife and 2 kids. My wife would call the hospital 3 times a day. For 9 days, 27 calls of them telling her there's no improvements. My family prepared for the worst. On the 10th day she got the call that I was awake and alive. That's it for today's video. If you enjoyed it, make sure to leave a like, subscribe, and comment down below what you thought about these stories. What would you do in their situation? Here are some other videos I highly recommend, and don't forget you'll find a wide variety of them on my channel. See you next time.